So it's a scenario that, well, many dog breeders have probably faced, right? You've done everything correctly. You think timing's spot on. The female seems perfectly fertile.
And yet, no puppies. Or maybe a much smaller litter than you expect.
Exactly. And, the immediate thought often jumps straight to the male dog. Could he be the issue?
It's a common question, and today that's what we're diving into, the real complexities of male infertility in dogs.
We got some pretty detailed medical insights here, source material we're going to unpack.
Yeah, and our goal, our mission for this deep dive is really to pull out the crucial bits for you, help you understand what might be going on, the potential causes, and how vets approach figuring it all out.
Okay, let's get right into it then. What does infertility actually mean in this context? Is it just zero chance?
Well, that's a really important distinction. It doesn't always mean total sterility, like absolutely no sperm production at all.
Oh, okay.
More often, infertility means a reduced capacity or sometimes an absent capacity, but basically an inability to get a fertile female pregnant.
Right.
And it can stem from a whole range of things that stop enough healthy motile sperm from reaching and fertilizing the egg. So it's about quantity, yes, but also very much about quality and function.
Quality and quantity, got it. Now, the source mentions a cycle, something like 70 days. What's that all about?
Oh, yes, spermatogenesis. The sperm-making process. It's fascinating, actually. It takes roughly 70 days, give or take, from the very start, the initial cell, to a fully mature sperm ready for action.
70 days?
Yeah, and most of that, about 62 days, happens right inside the testicles. Then there's another, say, 10 to 14 days where they mature and get stored in the epididymis.
Okay, so why is that 70-day number so important for breeders to know?
Well, it dictates the recovery time. If you have a problem that affects sperm production in the testicles, an infection, heat stress, whatever it is, even after you fix the problem,
Right.
you're looking at a minimum of another 70 days before you might see healthy sperm coming through again, because the whole production line has to restart, essentially.
Ah, I see. So no quick fixes if the problem's testicular.
Exactly. Now, if the issue is just in the epididymis, maybe a temporary blockage or something, you might see improvement faster, perhaps within that 10-14-day window.
Okay.
But the big takeaway here, really, for anyone dealing with this is patience. Understanding that 70-day cycle is absolutely critical. Don't expect miracles overnight.
That definitely puts things in perspective.
Yeah.
The material also throws around some specific terms, a zoospermia, oligozoospermia.
Yeah.
Can you break those down for us?
Sure thing. So a zoospermia, think A for no, zoo for sperm. It means complete absence of sperm in the ejaculate. None at all.
Okay, none. Got it.
Then oligozoospermia, oligo means few, so that's a low sperm count, fewer sperm than you'd expect.
Right.
Pteropanspermia terata relates to monsters or malformations. This means a high percentage of the sperm have abnormal shapes or structures. They might have two heads, bent tails, things like that.
And those abnormal ones can't fertilize.
Often they can't, or they're much less efficient. Finally, asthenospermia. Astheno means weakness, so this is reduced motility. The sperm aren't swimming properly or they're sluggish.
Weak swimmers.
Exactly. And you can have any one of these, or sometimes, a combination. A blockage might cause atherospermia. A problem in the testes might cause oligozoospermia or teratospermia. It all points to different potential underlying issues.
That's super helpful.
Yeah.
So what are the main culprits? What are the primary underlying causes that lead to these problems?
The medical info points to several big categories. First, impaired spermatogenesis itself. The factory just isn't producing sperm correctly or enough of it.
Okay, the production line is faulty.
Right. Then you have physical blockages, problems with the plumbing, the ducts that transport the sperm out.
Like a clogged pipe.
Exactly. Inflammation or infection in the reproductive organs is another big one. Tumors can also interfere. Environmental factors, too, like exposure to toxins or maybe even just excessive heat stress. Congenital issues, things the dog was born with. And endocrine problems, so hormonal imbalances.
Lots of possibilities.
Definitely. And one thing the sources really highlight is the increasing recognition of genetics playing a major role. It's not always just random bad luck. Sometimes it's literally in the dog's genes.
That's interesting. You mean inherited conditions are becoming more common, or we're just better at identifying them?
Probably a bit of both,
But
but the evidence does suggest a rise in identifiable, heritable causes. Cryptorchidism is a classic example.
That's undescended testicles, right?
Exactly. Where one or both don't drop into the scrotum, it's thought to be inherited, likely as a polygenic autosomal recessive trait, meaning multiple genes involved needs two copies. Complex, but definitely genetic.
And does that cause other issues too?
It can, yeah. It's linked to a higher risk of things like testicular cancer, torsion, and sometimes other issues like hernias or even kneecap problems, patellar luxation. Suggests a wider genetic link sometimes.
Wow. What other genetic factors are mentioned?
There's mention of alpha-L-fucosidase deficiency. That's a type of genetic storage disease that can mess with sperm development.
Okay.
And primary ciliary dyskinesia, PCD, that affects the tiny hair-like structures, cilia, which are vital for sperm movement, so that directly impacts motility.
Right, the swimmers again.
Exactly.
Yeah.
And interestingly, the source material also suggests that hypothyroidism, an underactive thyroid, its impact on male fertility is likely pretty minimal.
Oh, really? I feel like that gets blamed sometimes.
It does, but the direct link seems less strong than maybe previously thought, according to this.
Good to know. So just how common is male infertility in dogs overall? Do we have any idea?
The true incidence is hard to nail down, honestly, but the feeling among experts is that it's probably increasing.
Why?
Well, a lot of suspicion falls on breeding practices, particularly continued inbreeding within certain breeds.
Narrowing the gene pool.
Exactly. That can concentrate recessive genes, including those that might affect fertility. So breeds with smaller gene pools, or those where there's been really intensive line breeding or inbreeding, might see higher rates of specific problems.
And does age play a role?
Generally, yes. The likelihood of fertility issues does tend to go up as a male dog gets older, just like in many species.
Okay, so genetics, breeding, age, lots to consider. If you're an owner, what kinds of things might clue you in? What history or physical signs point towards infertility?
Well, the most obvious is what we started with. The dog consistently fails to produce litters, or the litters are unusually small despite good timing with fertile females. That's the #1 complaint.
Right. What else would a vet want to know?
Oh, lots of history.
And-
When did the testicles descend? What's his general temperament like? His libido or sex drive? Has he been bred before? How often?
Mm-hmm.
What timing methods were used? Were there any previous semen checks? If so, how did the sperm look? Did it survive chilling or freezing, if that was done?
Okay, detailed breeding history.
Very. Also, how is the semen handled? What were previous litter sizes like? Is there any family history of infertility in his lines? How inbred is he?
Wow, pedigree research comes into play.
Absolutely. And crucially, were the females he was bred to known to be fertile? What's his Brucella canis status? That's a key infectious cause. Any current or past medications, especially things like corticosteroids or steroid hormones, any major illnesses.
That's a lot of information. What about the physical exam itself? What's the vet looking for?
They'll do a careful check of the external bits, the sheath, the penis, looking for any growths, scar tissue, adhesions, anything abnormal. They'll gently push the penis out of the sheath while it's not erect to check its surface for lesions or trauma.
Okay.
Then palpation, feeling the testes and the epididymides, those structures attached to the testes. Checking for size, are they symmetrical? What's the consistency like? Any lumps, bumps, or tenderness?
And inside.
Yeah, a rectal exam is usually done too. That lets the vet feel the urethra as it passes through the pelvis and, importantly, assess the prostate gland for size, symmetry, or any pain.
Okay, so history and physical exam really set the stage. The source then talks about specific causes, splitting them into acquired things that happen after birth and congenital, things they're born with.
That's right.
And it says the most common cause of what looks like infertility is actually incorrect breeding timing.
Yeah.
Seems almost too simple.
It does, doesn't it? But it's incredibly common. You can have the most fertile male on the planet, but if you miss the female's fertile window, well, no pups. So ruling that out is step 1.
Always check the timing first. Makes sense. What about other acquired causes then?
There's a whole list. Things like incomplete ejaculation, maybe the dog is stressed, unfamiliar place, slippery floor, no receptive female present, or even intimidated by another dog.
Environmental factors.
Actual blockages in those ducts we mentioned can happen for various reasons, sometimes even scar tissue from previous infections or trauma, or even botched vasectomy attempts, believe it or not. Hyperthermia, the testicles getting too hot, that can definitely shut down sperm production temporarily. Inflammation or infection of the testes called orchitis, often bacterial, like E. coli.
Infections, right.
The role of thyroid issues or high prolactin levels is still a bit murky, as we mentioned. But Cushing's disease, hyperadrenocorticism, that can cause testicular shrinkage and problems.
Hormonal diseases too.
Yep. Certain drugs can impact fertility. Exposure to environmental toxins is a possibility, though often hard to prove. Physical trauma to the area, testicular cancer, sadly. Any major systemic illness can affect fertility too. Reduced blood flow, ischemia, prostatic disease.
It's a long list.
It is. Even the effects of inbreeding itself over generations can be considered an acquired issue in a way, impacting sperm quality. There's also lymphocytic orchitis and immune-mediated inflammation, sometimes seen in families. And one more, retrograde ejaculation.
What's that?
That's where the semen goes backwards into the bladder during ejaculation instead of forwards out of the penis. So you might see very little or no fluid come out.
Fascinating. Okay, that covers a lot of things that can happen during a dog's life.
Yeah.
What about the congenital causes, the ones they're born with?
These often involve basic developmental issues. Chromosomal abnormalities are one category, like having an extra sex chromosome, XXY syndrome, or other disorders of sexual development.
Okay.
There's something called germinal cell aplasia, sometimes nicknamed Sertoli cell-only syndrome. Basically, the testicles develop, but they're missing the crucial germ cells that actually make the sperm.
So the factory floor is empty.
Pretty much. And segmental aplasia, where parts of the transport system, the epididymis or the vas deferens, just don't form properly.
Yeah.
That leads to a blockage right from the start, causing low sperm count or no sperm.
It really highlights how many different things have to go right. Are there specific risk factors that make a dog more likely to have these problems?
The source points out a couple of key ones. Obviously, having any known congenital disorder that affects the reproductive system puts a dog at higher risk.
Makes sense.
And maybe less obviously, but importantly, using stud dogs or even teaser males without proper health screening, especially for infectious diseases like Brucella canis or other bacteria that can cause genital tract infections. That's a big risk factor for spreading problems.
A good point about health testing. Okay, we've talked causes and risks. How does a vet actually figure out which problem is causing the infertility? What's the diagnostic journey look like?
Well, as we said, step one, always, always, always confirm the female is fertile and the timing was right. You have to rule that out before putting the male through a whole workup.
Right, assuming that checks out.
Then you move to the male. Often routine blood tests and urine tests will actually come back normal in infertile dogs.
Oh, okay.
But they can show clues if there's an underlying illness or signs suggesting brucellosis infection or maybe inflammation of the prostatitis.
So basic tests might be normal. What about hormones? You mentioned endocrine profiles.
Yeah, hormone testing can be really useful. Measuring baseline testosterone is a start, but sometimes you need more. If you suspect a retained testicle, cryptorchidism. A stimulation test using hormones like GnRH or HCG can help. You give the hormone and see if testosterone levels rise. It basically asks if there's hidden testicular tissue there and if it's working.
Like poking it to see if it responds.
Kinda, yeah. Low testosterone combined with high levels of other hormones like FSH and LH can point towards primary testicular failure. The tests themselves aren't working right. High FSH with normal testosterone might suggest a problem just with the sperm-making cells.
Interesting patterns.
Definitely. And you typically include thyroid hormone checks and, absolutely critically, testing for Brucella canis. Newer tests like AMH, anti-Müllerian hormone, are also coming into play to assess testicular tissue.
What about looking inside? Does imaging like ultrasound help?
Oh, absolutely. Ultrasound is great for getting a look at the testicles, the epididymides, the prostate. You can see structural changes, cysts, inflammation, sometimes even tumors. It's non-invasive and gives a lot of information.
Okay. And then the big one seems to be the breeding soundness exam, collecting and analyzing semen.
That's the cornerstone, really. A proper exam involves collecting semen, usually at least twice, maybe a few days apart, just to get a representative picture.
Why twice?
Sperm counts can vary, and the second sample is often more representative of the dog's actual production capability. You collect different fractions of the ejaculate, specifically aiming for the sperm-rich part and the prostatic fluid part.
And then analyze it.
Yep. Detailed analysis, you look at the volume, sperm concentration, how many million per ml, motility, what percentage are swimming progressively forward, and morphology, what percentage look normal under the microscope.
Checking for those abnormal shapes we talked about.
Exactly. Plus, you look at the cells under a microscope, cytology, for signs of inflammation, like white blood cells, and you usually culture it for bacteria too.
What if there are white blood cells?
A high number, especially in that sperm-rich fraction, strongly suggests inflammation or infection somewhere in the tract. If the first sample shows no sperm, azoospermia, or very few, oligozoospermia, you definitely want to repeat the collection to confirm it wasn't just a fluke or poor collection.
Makes sense.
Yeah.
The article mentioned epididymal markers, too. What's that about?
Yeah, that usually refers to measuring alkaline phosphatase, or ALP, in the seminal fluid. ALP levels are normally very high in the fluid coming from the epididymis.
Okay.
So if you collect a full ejaculate and the ALP level is really low, it can suggest there's a blockage before the epididymis contributes its fluid, like an obstruction higher up. Sometimes testing ALP on two samples collected an hour apart gives even more info.
Clever. And what about a testicular biopsy? When does it get to that point? Sounds more involved.
It is more invasive, yeah. A biopsy is really the definitive way to see what's actually happening inside the testicle at the microscopic level. Is sperm production happening normally? Partially, not at all.
So it tells you if the factory is working.
Exactly. It's especially helpful to distinguish between a production problem, testicular failure, and a transport problem, obstruction. You can have normal production, but a blockage, leading to azoospermia. The biopsy helps sort that out. Usually, a small surgical incision, an incisional biopsy, gives better results than just a needle poke.
Right. Okay, so after potentially all that testing, you find a cause. What can actually be done? What are the treatment options?
Well, it totally depends on the diagnosis, of course.
Yeah.
If it's something like hyperthermia, overheating, then strict rest and keeping the dog cool is step one.
Simple enough.
Ensuring a good, balanced diet is always important. Avoiding unproven supplements, especially things claiming to be steroids, is crucial.
Good advice.
And client education is huge, making sure you, the owner, understand that 70-day timeline for potential recovery. It takes time.
Patience again.
Always. For some things, surgery might be an option. Like there was a vasectomy. Sometimes the tubes, the vas deferens, can be reconnected, reanastomosis.
Okay. What about medications?
If there's a bacterial infection like prostatitis or orchitis, then antibiotics are key. The source mentions specific ones that penetrate those tissues well, like chloramphenicol, trimethoprim sulfa, erythromycin, and rofloxacin, and often it needs a long course, like 3 to 4 weeks or even more.
Limit.
Yeah. For retrograde ejaculation, where semen goes into the bladder, sometimes medications like pseudoephedrine or phenylpropanolamine can help tighten the bladder neck sphincter and encourage forward ejaculation. But you have to be careful. Some antibiotics have side effects or shouldn't be used in breeding males.
Right. Always follow veterinary guidance. So treatment can be complex and take time. What about follow-up and prevention?
Monitoring is key. Regular rechecks, including semen analysis, but always keeping that 70-day spermatogenic cycle in mind when you're judging the response to treatment.
Don't expect changes next week.
Exactly. For prevention, avoiding extremes of temperature, especially heat, is a practical step. Good hygiene, proper health testing before breeding. Common sense things.
And is there hope? What are the success rates like?
Encouragingly, yes. The source material suggests that with an accurate diagnosis and the right treatment tailored to the cause, a return to fertility is possible in a decent number of cases, maybe around 50 to 60%.
That's actually pretty good, considering the complexity.
It is. It shows that a thorough workup can often lead to successful outcomes.
Okay, so wrapping this up, our deep dive really shows that canine male infertility isn't straightforward. It's got layers, genetics, environment, health, management, all playing a part.
Absolutely. Getting to the bottom of it takes a systematic approach, understanding that sperm production cycle and patience. It's rarely a single, simple answer.
Which brings us to a final thought, maybe something for you listeners to ponder.
Yeah.
Given everything we've discussed, the complexity, the potential rise linked to breeding practices, what does this mean for the bigger picture, for the health and genetic diversity of certain dog breeds? What responsibility falls on breeders, on owners, to really understand these issues and maybe address them more proactively?
Yeah, it's definitely food for thought. How do we balance breed standards and desired traits with long-term reproductive health and genetic robustness?
Something to consider. As always, we hope this deep dive has given you valuable insights. If you have more questions, keep exploring and definitely talk things over with your veterinarian.